My name is Chris Terabasi, and I'll be your presenter for today. The reason why we are here today is we're going to talk about some emergency legislation that actually went into effect about a month ago that was handed down through OSHA that we are obliged to participate because we see patients who have been exposed to COVID-19, as well as the fact that we're a healthcare facility. So I'm going to go through a series of slides. You do have the opportunity during the presentation to chat, and you can ask a question in the chat. We'll do our best to answer live. Those questions we can't answer, we'll get back to you at a later date. This program is being recorded and will be available on our YouTube channel. Not that I know how that's going to happen, but we'll get that done in the near future for folks that are unable to join us during this live broadcast. So again, if you have any questions, please feel free to chat them. There will be some poll questions we'll ask you to participate with, and there'll be some handouts that we'll give you along the way that you can take with you. You can download and copy. Lastly, there is an attestation, so we'll ask you to print that and give it to your immediate supervisors so Dawn can keep track here of those that have seen this mandatory program. So without further ado, let's proceed. Again, the introduction is, as you all can expect, and a lot of this is common sense, that COVID is going to be around for a long time. It's not going away anytime soon. And as current as this presentation is today, things are changing all the time with regards to COVID and what's expected of us as employers. But overall, what has not changed is our goal as medical health associates and the division is create and maintain a safe work environment for you, our patients, and our guests. So what we're here to talk about is this thing called the Emergency Temporary Standard, ETS for short. And believe it or not, there's a subpart U, which frankly, I don't know what that means, but the fact of the matter is that this is all about giving us guidance and policies and procedures about what we're expected to follow with regards to how we manage our offices. So MHA, as you can imagine, is committed to implementing this thing called a multi-layered interventions, which basically means we're trying to attack this from many different ways. So, for example, we're going to continue to strongly promote vaccination across all of our staff. Well, we do believe the science is valid. We do continue to follow what the CDC says as the gold standard. Although we're always paying attention to like the county and others that have respectable ways of presenting the science. We will grant paid time off for employees who want to get vaccinated. We will instruct workers who are infected, unvaccinated workers who have had close contact or who have tested positive, and we're gonna encourage everyone, basically, if you are sick, to stay home. We're going to provide unvaccinated and otherwise at-risk workers with N95, surgical masks, and depending on what you're doing in your position with other PPE is necessary. We're going to educate and train workers as we continue to learn about COVID and have these policies and procedures in any format necessary to get the message across. So, the standard expects us to share basic facts about COVID, and we'll continue to educate as best we can. But when all is said and done, it's stuff that we've been doing right from the beginning: distancing, vaccination, use of face coverings, appropriate face coverings, and hand hygiene. We're going to continue to look to have policies and procedures to protect you and all of us from the hazards of COVID. We're going to require unvaccinated customers, visitors, and guests to wear facial coverings. If we do have COVID infections or, God forbid, deaths, we're obliged to record and report them. And we're going to continue to implement protections. There can be no retaliation from anyone who reports or believes there's a concern with regards to COVID amongst our workers. So we're obliged to not have retaliation, and we, in fact, have protections for folks that have to report and work with us on maintaining our safe standards. And of course, OSHA, and I'll just mention here that OSHA is not done yet. The president, if you're aware, has an executive order that came out a couple of weeks ago. Since that executive order came out, we have had no further instructions from OSHA, but OSHA is the agency within the federal government that will be assigning new regulations, and specifically will impact MHA because we do have over 100 employees in our company. So we are ready to listen, and we will, of course, comply as best we can with whatever standards OSHA does in the future. So we have a poll question, and the poll question is, I'm going to put up a poll question, and we're going to ask you for those that are individuals and those that are in groups. Here it comes, the poll now. We'll give it a few seconds, and the question is that PPP is readily, publish it. Thank you, Don. That PPP is readily available in my division, and I know where to find it. Yes, no, and the question is, what's PPE? And the good news is I'm not seeing anybody who doesn't know what PPE is, so I think we're good about ending the poll. And 100% of the folks say that they know where to find PPE. So we're off to a great start. Thank you for that. And next, okay, thank you. Dawn is right next to me, thank goodness. So here's our general policy statement. The standard, as it's written, exempts fully vaccinated employees from masking, distancing, and barrier requirements while in a well-defined areas where there's no reasonable expectation that any person with suspected or confirmed COVID will be present. Very straightforward. However, until further notice, because we are a healthcare facility, mask mandates remain in place for MHA clinical areas and in other areas at the discretion of the MHA offices. And that's frankly because each of the MHA offices is geographically laid out differently. And as such, there's different levels of exposure with patients or to patients and others that cause the individual office that may have different rules with regards to where you must wear masks and where you might have some more flexibility to not wear masks. Key requirements of the standard is, one, we have to develop a COVID-19 plan, which includes a compliance requirement. And what we're doing right now is actually part of that compliance requirement, where we're obliged to inform, educate, and be sure folks are all on the same page about what our responsibilities are with COVID. We need to monitor points of entry to screen patients and others. Again, you guys have been doing that right along, so that's nothing new. We need to track adherence to CDC guidelines. So when we have new guidance come out, we're going to do something similar to this, perhaps not as exciting as this particular webinar, but somehow we'll get the news out to all of you. We need to continue to provide PPE to all staff at our expense. We need to limit exposures as best we can to suspected or known infected patients. We need to protect the unvaccinated as best we can with social distancing and physical barriers. And lastly, clean and disinfect. I can't tell you the number of times this thing came up in the standards that we're obliged to clean and disinfect our offices after visits, at the end of the day, and in between. We need to be conscious of cleaning and disinfecting our offices. Key requirements continue. Training staff, like we're doing right now. We need to continue to provide information as best we can. We will use whatever means we can have available to send a message. For example, this webinar, for example, the communications part of Paylocity. I know you all read them religiously. If you don't, you should, and pass the message on for those that don't. We will continue to file CDC recommendations, and we will encourage people and expect you to self-screen for symptoms before coming to work. Call it a daily self-assessment. How are you feeling? Do you have any symptoms? Things like that would perhaps convince you to just avoid coming to work if you feel ill. So overall masks will remain required within the clinical offices of MHA. Vaccinated employees may remove masks in non-patient contact areas, although, again, it depends on the geography and the rules within your specific office as to whether or not you can unmask in administrative and non-patient contact areas. So please refer to or speak with your immediate supervisor about where you must and where you must wear a mask and where those areas where you do not have to wear a mask. And again, unvaccinated employees are expected and required to wear an N95 or a 3-ply surgical procedure mask, or if there's an office-approved facial covering. Again, check with your immediate supervisor as to whether or not the facial covering that's not an N95 or a 3-ply is appropriate. Okay, yes, there are more requirements. You're required, employees are required, you are required to notify MHA if you receive a positive COVID test or are suspected of having COVID-19. There is an assessment that needs to be done if you believe you've been exposed that we need to do. And it goes beyond that obligation, because if we as your employer are informed that you have a test or that you may have been exposed, then we have to go and we may have to notify certain employees who have perhaps been around you about whether or not they need to be tested or quarantined. We need to advise you of what the quarantine requirements. We'll go over that in a little bit. Of course, we have to provide reasonable time, and we will. If you are unvaccinated and want to get vaccinated, we are required, and we will, of course, give you time off, paid time off for that. And if you have side effects from the vaccination, we will. And again, we need to continue to train and validate that there's understanding of the training and so on. To close that particular point of this discussion, be aware that there are protections from retaliation under the standard that exists. So we cannot retaliate if you I don't know, make a claim against somebody else for not notifying us of their exposure or infection. We do have a log. It's kept in Human Resources. We do have a log of employee instances of COVID that we are keeping track of. And again, we're obliged to do this under this standard. And of course, God forbid, if we have any fatalities or inpatient hospitalizations, we are required to report them to OSHA. Okay, there's another poll question. And hopefully I'll be able to look at Dawn. It's right here. Okay, which is not included in the ETS requirements. And I have to publish it again because I keep forgetting to do that. There you go. Here are the which are not included. Which of these is not included? Not vaccinated, mask up always. If you want to get a vaccination, I get paid while I'm getting it. If I test positive for COVID-19, it remains no one's business but mine. So the votes are coming in. We'll give it another second. And see, these are just snowball. These questions are too easy, for goodness sake. Of course, the answer is if you test positive, it remains no one's business but mine. You're obliged to inform your employer if you have a COVID infection or suspected exposure. Okay, let's talk about risk assessment. According to the standard, our medical offices like MHA are put into the medium risk classification. And all that means is that in our office, we have frequent and or close contact within 6 feet of people who may be infected, but are not known as suspected COVID patients. So by virtue of that, we are placed in the medium risk classification. Okay, standard precautions. Again, a lot of this is common sense. You've done this over and over again, but it needs to be repeated. You need to perform a daily self-assessment. How you doing? How you feeling? If you're unsure, and I don't have a slide for that, but if you're unsure, CDC has a list of symptoms, and it's a laundry list. It's a long laundry list of symptoms that are associated or have been associated with COVID that you might want to look into on their website. But you're expected to perform daily self-assessment. You're expected to perform hand hygiene. You use your PPE wherever there's an expectation of possible exposure. You follow respiratory hygiene, cough etiquette principles, which is a fancy way of saying cough into your sleeve, not into your hand, I guess. Ensure appropriate patient placement, especially if they're symptomatic. Properly handle and properly clean, disinfect and clean in your environment, and self-injection practices, and of course, worker safety, handling of sharps and biohazardous waste. I don't think that's really part of the standard, but they stuck it in there because we have to be careful with that every day anyways. Poll question number 3. I'm going to do it myself this time. Is it it? One more. Okay. So close, so close. Publish. Okay. Have you been trained or have you seen a posting on the proper procedure for hand hygiene? Be honest now, folks. Go ahead. Make your vote. Wow. Did we only give them one choice? Is that what we did?
I gave them that.
I gave them that. Okay. So I would expect that there's somewhere in your office, if it's not there, you should ask your immediate supervisor, that somewhere there is a handout on how to properly wash your hands. Believe it or not, there is a CDC written guideline on how to properly wash your hands. So if you have not seen it, I would ask that you check with your immediate supervisor, and he or she will show you exactly where it is located. End poll. There we go. All right, moving on. Physical environment. Again, we've been doing this stuff. The good news is this is nothing new for us. We've been concerned in our waiting areas about spacing. We've used dividers. We do have cleaning schedules from what I've seen in the offices. There's hand sanitizers and tissues everywhere. Clinical areas. Please continue to schedule and disinfect your offices frequently. And again, hand sanitizer and tissues. These are being restated by OSHA to reemphasize the need to do it in case you didn't already know it. The good news is we're great at this stuff now, so just continue what we're doing. Continue break room as usual. The standard aside, please clean up to yourself. Don't leave it to somebody else to clean up your microwave or what else you got going on. If you're unvaccinated, you should remain masked unless you are eating. Again, and cleaning schedule for employee touch items, phones, keyboards. We all should take a moment. Don't leave it to the cleaning people to get a wipe your phone handle, wipe your keyboards, your computer keyboards, your touchscreens if you have them. Your mice and your mouses, your mice around your workstation. Don't leave it for somebody else. Take it once a week at least or so. Clean whatever you've been touching, especially if it's a phone or something shared by others. Common areas, be aware of your common areas, of course. Take a walk around. It's not a bad idea every once in a while to sit in your waiting room, look around. Sit in the front desk area, look around. What do you see? What do patients see from the perspective of where they're sitting? Do you see potentially hazardous areas, or do you see potentially areas where a patient could touch something that they shouldn't be touching? Medical waste areas or needle containers. Take a look around your areas. Patient processing. Since immunization is unknown when people walk in, we should assume that everybody is potentially infectious. And of course, that's nothing new as well. So wear your 3-ply masks, surgical masks, N95s, approved facial coverings throughout the office. Again, we'll say this with the HIPAA privacy. No one should walk through the office unsupervised. We should instruct patients and guests to wear masks. Now, there have been a case, and actually there was a case in a Buffalo pediatric office where an incoming mom objected to putting on a mask when asked, and she pepper sprayed the front desk person. So there are some folks that have they're probably crazy, but they have a very high sensitivity to this whole thing. But please don't put yourself in harm's way if you run to a patient who has an objection. Feel free to certainly get someone, your immediate supervisor, to come out and take that person offline as quickly as possible. MHA will provide whatever it needs to provide through the divisions to keep you safe in terms of facial tissues and hand sanitizers and hand washing facilities. You can always give the patients the option to wait in the car, and then you buzz them with the cell phone, which I know has been done by some of the offices. Okay, in the standard, there's something called Appendix A. Excuse me. There is an official employer notification tool. If we're involved that a person who is in our workplace, an employee, client, somebody, has been exposed or is COVID positive, these are the steps we must follow. We have to identify and notify each employee who is in close contact. And there is a pretty standard definition of what close contact is in CDC. 6 feet, within 6 feet for 15 or more minutes for over 24 hours is the standard for close contact. We need to remove these employees from the workplace for 14 days or 7 days if there's a negative COVID test. And again, these are subject to change, but these are the basic guidelines. Removal is not necessary if the person is asymptomatic and fully vaccinated, or if within 90 days recovered from a COVID-19 infection. And for those who are not deemed to be in close contact, we just need to notify all other employees in the general vicinity that there was a possible transmission. So this is the official OSHA standard for how we need to notify folks in the event of a known infection or suspected. And really, folks, that's the extent of the presentation today. Hopefully, it clarified some things for you. Certainly, I don't see anything in the chat that we need to respond to from an question and answer. But certainly, after this presentation, I encourage you to send questions to me directly if you wish. If you don't know my email address, your direct supervisor certainly knows how to do it. Really, that concludes the presentation for today. I am right now with my right hand over here being Dawn, sharing a couple of documents. One is the official OSHA Policy and Procedures Manual as a PDF that exists already with your leadership folks, but you're certainly welcome to download it and review it. It is, I believe, 19 or so pages long. I did my best to consolidate it, hit the salient points. And lastly, we did also include as an additional handout the CDC guidelines on how to wash your hands. So with that, I thank you for your time and your attention. And that's it. Well, have a good day. Appreciate your time. Do I hit that button there? Okay. Bye.